First of all, I would like to thank the Society Internationale Urology and, of course, Professor Rosetta for all those efforts. Today, our question has been just MRI targeted biopsy versus systematic biopsy. Firstly, let's look at the clinical needs for prostate cancer diagnosis, which have just been mentioned. And it seems that MRI targeted biopsy meets lots of these needs better than systematic biopsy. It detects more clinically significant cancers and less clinically insignificant cancers compared with standard biopsies. With the addition of MRI targeted biopsy, better risk assessment can be made compared to just systematic biopsy alone. And according to the last meta-analysis, it is cost-effective. So, as the previous speakers have mentioned before, MR-targeted biopsy is a lot more efficient method than systematic biopsy. However, I have a question. All this effort, is it really worth it? Let's look through the results of the publications. On the slide, you can see the difference in the rates of cancer detection using MRI-targeted biopsy and systematic biopsy. The red dot represents the difference in detection of clinically significant prostate cancer, and the green dot represents clinically insignificant cancers. According to the early publications, the results were quite impressive, as you can see. However, if we compare the results published in following years, the efficiency of the targeted biopsy is not that obvious. Even if the results of the last publications are not impressive, we still can see that targeted biopsy is more effective than systematic biopsy, but not good enough to completely give up systematic biopsy. We have to perform systematic biopsy along with the targeted biopsy. Otherwise, we can miss 5 to 10% of clinically significant prostate cancer. It's also clearly stated by the guidelines that we must combine targeted and systematic biopsy, especially for the biopsy-naive patients. However, for the patients with prior negative biopsy, I think it's a still question mark. Turning back to the results of the publications, why are the results not as good as we thought in the beginning? Is it the real capacity of the MRI-targeted biopsy, or are there any other factors that affect the results? Let's look at the steps of targeted biopsies for the answer. As you see, there are so many steps. Any challenges with target selecting, poor MRI, interpretation errors. All of these factors can affect all types of MRI targeted biopsy outcomes. And misleading during the procedures on MRI transfusion biopsy, like registration errors and operators errors, can cause unsuccessful outcomes also. And I think the interpretation errors is one of the biggest problems in the MRI-targeted biopsy. And many publications draw attention to this issue. In addition, regardless of all these factors, MRI invisible tumors and tumor heterogeneity can also cause unsuccessful outcomes. All of these factors might affect the results of the publications. Different centers, devices, different radiologists, different urologists. I think it may explain those confusing results. Now, here are take-home messages. Firstly, MRI-targeted biopsy has advantages when compared with systematic biopsy. It detects more clinically significant cancers and less clinically insignificant cancers. Addition of targeted biopsy to systematic biopsy leads to better risk stratification, and it's cost-effective. And I want to draw your attention to the fact that image and report quality of MRI should be adequate. On all procedure steps of MRI-targeted biopsy, the requirements should be fulfilled. The guidelines recommend to perform systematic biopsy along with the targeted biopsy for biopsy-naive patients. But I think it's still a question mark for patients with prior negative biopsy. And biopsy strategy may be or might be changed individually based on PIRAS scores in the future, as the previous speakers mentioned. And then another matter, be careful for the new methods which have been released as a game changer until the adequate data has been collected in literature. Thank you so much. Finally, I would like to announce the next webinar on the topic of how to personalize nerve-sparing radical prostatectomy by Professor Paulo John Gontero on the 23rd of May. Okay, thank you so much.